Now, News 2 at 4.
Overdose deaths are on the decline in Davidson County, according to Metro's Department of Health. Well, that has some addiction treatment doctors surprised because of the increased presence of the deadly synthetic opioid fentanyl. News 2's Tori Gessner has those details.
To many, they may look like numbers on a chart, but to Dr. Chapman Sledge at Cumberland Heights, they're his patients.
Started doing this work in the late 80s, and I never would have dreamed we'd be seeing the opioid addiction that we're seeing.
According to Metro's Department of Health, 520 people have died of a suspected overdose so far this year, down slightly compared to this time last year at 538 overdose deaths. Both years, fentanyl was detected more than 76% of the time.
I absolutely hate fentanyl. With fentanyl in the supply as commonly as it is, I'm surprised that more people aren't dying.
Sledge says the opioid epidemic is progressing in phases, starting with prescription pain pills in the late 90s, shifting to heroin a few years later. Now, fentanyl is the main opioid of abuse, according to Sledge. It's deadlier, stronger, and triggers an addiction that's much harder to treat.
It takes very little time from the initial use of fentanyl to the compulsive use of fentanyl, and it's so risky and so scary and so difficult to treat.
Anyone who uses any drug is at risk of ingesting it. Oftentimes, it happens on accident.
How often do you see that, where people think they're taking something and then it's fentanyl?
Every day. We see every day people showing up thinking they're using cocaine, and there's fentanyl present in the methamphetamine, or there's fentanyl present in the cocaine supply. It's so common.
Because fentanyl is so easy to get into the U.S., Sledge doesn't expect it to go away anytime soon. Dr. Sledge says the number of patients at Cumberland Heights has stayed steady, but he believes part of the reason for the slight decline in overdose deaths in Davidson County is because more people have access to the overdose reversing drug naloxone. It's now available over the counter. Mark.